It's 1:35. Welcome to the Clinical Consultation Network. It's great to have you here today. You've got a treat in store for you because this is my good friend, Julie Brown, and she's from Massachusetts, and she is here to talk to us about her skills system. You came here, let's see, it was a few months ago, maybe back in January, I guess after the beginning of 2019, when you came here and trained about 65 people in the skills system. I think if I understood correctly, and I don't want to lock anybody in, but I think one of our NCOs is thinking about having you back again to do some more training. And I am really thankful for you to come here today at the last Clinical Consultation Network of the decade. I want to introduce to you today now someone who's become a real colleague with me and with Michelle and several others here in the state is Julie Brown. And so, Julie, maybe before we get into the skills system, you could just maybe give us a little bit of an introduction to yourself and tell us a little bit about yourself, maybe where you come from, where you've been, where you're going, those types of things.
All right. Well, Bruce, thanks so much for having me. It's awesome seeing you. I wish I could see everybody on the call. So I'm Julie Brown. I'm a social worker, kind of a super social worker, really into it, taking a systems approach to a lot of the problems that the folks with dual diagnosis experience. So I've been in the disabilities field for a really long time. Started out with adolescents and, didn't really know what to do. And so I got DBT trained. And so I am a DBT trainer. When I got my intensive training certificate, I actually did a cartwheel in the group, and everyone thought I was pretty crazy and insane. So I'm in love with DBT, but realized that, you know what, it's just too complicated. The skills were too complicated over time. And so I eventually somehow got in to be a DBT trainer. I think it was a relentless assault on behavioral tech, with me constantly kind of talking to them about this population, and they, in 2005, had me come on board as a DBT trainer with Dr. Linehan.
Yeah.
And kind of has been a process under their, with their approval, and just trying to improve access of DBT skills for people with intellectual disabilities. So it was pretty tricky because they were under the impression that really if you were just a great teacher, you could teach all these concepts. And the problem was that their idea was to really water it down. And in my mind, I was like, well, that's not going to help them think dialectically and to understand these concepts in their lives while they're getting attacked by a housemaid or they're, in their context. They really need it made smarter, not the other direction. So
you mentioned Marsha Linehan, basically the person who got all this started with dialectical behavior therapy, and so you actually went to her school.
Oh yeah. Since about 2005, I've been a DBT trainer we'd work with Marsha and also all the other trainers. And so it was a real privilege. I was kind of, it was kind of a Forrest Gump situation where I was in there and had no idea how I got there, but I have to say just being, with them and being able to sort of calibrate the work right directly to Marsha's work was really important. And I also met James Gross, who's an important researcher in the emotion regulation field, and I took the skill system and I didn't beg, but, I was close to begging, and he reviewed it and offered a few suggestions. So he's one of the endorsers of the skill system. So he's kind of the daddy of the skill system, and Marsha's kind of the stepmom. So between those guys, I'm feeling like our population is in pretty good hands. So what I had to do is I took all the concepts and had to basically deconstruct the apparatus to try to look at the conceptual components that we needed and then reassemble it in a way similar to, say, a task analysis, where I had to understand the foundational pieces or micro transitions to be able to cope effectively. So
Well, and I've seen lots of different attempts to do this, and I don't want to say attempts. I think some people have done a pretty good job with it, but I will say that you have done the best job that I've seen anybody do.
Well, part of it, Bruce, it really wasn't just me. It was a dance or a qualitative process between me and the clients that I was treating. So I was treating, probably 40 folks with in the moderate and mild range of intellectual disability, as well as multiple diagnoses, mental health diagnoses. Probably half of them had been in jail, psychiatric hospitals, really sort of our level 8 or whatever you call it, just sort of the most double diamond clients, and so I used, I worked with that group over a period of, before this got published the first time, at least 10 years together. And so it would be, take a concept, roll it out with them. We chiseled it together, which is why, when folks do run a group or do teaching and they get proficient at it, they say, wow, the clients really, the clients that, have some verbal ability, it tends to kind of fit them pretty well.
So you actually got to meet and work with Marsha Linehan herself.
Speaking of, I peed in her bathroom.
Oh my gosh! Okay.
I know. It's a name dropper.
Yeah.
Yeah.
No Bristol stool chart.
Well, I probably could have gotten some good data there, but.
Okay.
Yeah.
Well, so my question is, what is she like? I have seen her on.
Wait 1 second.
I really met her, so.
Wait 1 second. All right. Hi, you guys. So here she is. Wait. You can't see her in the picture if you guys aren't there, but she's spooning out food to me, and she reminds me of my mother, except so I have a little complex there, little mom thing, but she's very scary. She's very brilliant and very scary, and so I have ultimate respect for her, and she's very, very funny, and I'm afraid of her. So, and then, so it was an exposure. It seemed like every trainer's meeting I had to sit next to her, and then, I got used to it, and finally, I don't have panic attacks anymore. So.
You got desensitized.
Yeah, I get desensitized to it. It's really good, and anytime you're changing DBT, it's something that you don't do lightly. And so, adherence is critical, given all the research. And so, I was always very happy that they kept me in the fold and allowed me to do this work for this population. But I have to say, once the final book was published in 2016, it was put in front of the DBT Strategic Planning Board. 7 people, the top DBT people, were asked to decide whether we could put DBT-4 intellectual disabilities on the cover. And they divided up the book by chapter, gave each chapter to each person for some reason, and they evaluated it, and they came back, and 4 of the 7 said, we didn't find anything not adherent to DBT, but what we thought was that we didn't understand why it needed to be changed for people with intellectual disabilities. They just felt that they should have been able to understand it in its first form. So the publisher had a few expletives about that, questioning that judgment. So I think that kind of shows sometimes that the general treatment population doesn't always really understand sort of what our population needs, and in that way they really miss it. And then there are gaps that our clients sit in, untreated, without the tools that they need, and the clinicians without the tools that they need, because everybody's thinking that all you need to do is be a better teacher.
If you've experienced trauma, if you have these behaviors that we associate with borderline personality disorder, you need this treatment. And the unfortunate aspect of keeping it too complicated for our group is that they don't get it. They don't receive the treatment that they need to help them.
Yeah, exactly. And I think that one cool thing is we're kind of taking it even further. One of the things that DBT did was it says, look, these things are a transactional problem. That what happens is it's not co-regulation that happens, it's co-dysregulation that happens between this vulnerable individual and, in our case, I think a vulnerable environment that gets very stressed. And so this process that happens of co-dysregulation, sometimes gets attributed to the client more so, and our systems are very complex, and they don't really have tools either other than either, psychiatric, the psychiatric route with medication or sort of emergency supports, that nonviolent crisis intervention material of de-escalation and then emergency procedures, things like that. Everybody's pretty good at that. But what's missing is just kind of when people are in their teachable moments and then giving them tangible skills to actually improve their core functioning capacities during those teachable moments. And then having a language to share so that they can actually generalize what they learn, with people that know how to coach and know how to facilitate that for them. So, that's one of the cool things about the new skill system model and the new e-learning and things like that. It's attempting to bridge those gaps and get people, on the same page.
Yeah. As a board certified behavior analyst, I'm a licensed professional counselor and a board certified behavior analyst. And one of the things that I often struggle with is what am I trying, and I know what I'm trying to teach a person not to do.
Exactly.
What I don't want them to do. But I struggle sometimes with figuring out, exactly what I need to be working on and getting it kind of small enough that it can be really worked on as a replacement skill. And so that's, one of the things I think I find really helpful about your system is that you support.
It's definitely granular. I kind of say in training sometimes, talk about being in the moment. The moment's 60 seconds, a minute, and a lot can go wrong in a minute for our clients. And so we have to be more granular than that. They have to practice, tools over and over again so they get better at all the these micro transitions that have to happen. And if we don't know what people need, what we need to do and what they need to do in the moment to self-regulate, then we're really not going to be able to coach it and teach it. So by having that sort of toolbox, I think it really helps us understand how to transfer those skills over. But at the same time, it also helps us self-regulate, because sometimes when we're dealing with folks with escalated behaviors or maybe they're, quote unquote non-compliant or, just kind of, you're having a hard time with them, or maybe they're less verbal, whatever. It's really important that we're self-regulated and, are making sure that our end of the equation, that we're not doing, the things that are going to be exacerbating this co-dysregulation. So I think that's important too.
In that moment, one of the tools that helps me sometimes is trying to pretend that I'm on Quaaludes.
Oh, there you go. I've never tried that, so I would be a hard one.
Self-regulate that. Now, I've never taken Quaaludes, so I don't but I am going to say that it really helps me kind of really just slow down my throat. But, I think what you're talking about is actually adopting some of the skills from the skills system and using those yourself so that you can model and demonstrate for the person.
Yeah, there's a few basic, there's like a few basic concepts that can guide our interactions, and the e-learning has one course on it, which is about skills, and then our second course will be out in February or March, which is skills coaching, and this is really where the skills coaching piece comes in, and just one of the things is that there's a feelings rating scale that kind of talks about the levels of emotion, and then the categories of skills are really important around, look, there's certain things we can do when we're, sort of in our mind, and we can do a lot of sort of interactive things like problem solving and expressing and getting it right in relationship care. You were talking about mediation before, kind of repairing relationships. All that is high level, takes a lot of processing capacity. We have to have a lot of distress tolerance because who knows what the other person's going to say or do. So we have to have our bearings, so that's when people are 0 to 3. And so it's really important that the environment understands that there are certain things we do at 0 to 3, but then once the person's cognitively dysregulated or emotionally dysregulated at that level 4 zone, where they really can't put things together and can't process, that by doing some of those more advanced processes like problem solving and expressing and getting it right, relationship care, we're actually stepping right into dysregulating the person. So I think those are, important concepts for the environment to know and have clarity about, because sometimes as care providers, sometimes we think that we don't have to follow the same sort of rules because we have this sort of innate capacity somehow, even because we're empathetic and tuned in. But it takes kind of more than that.
I think that's a consistent observation on the part of a lot of people because, like, one of the calm-only skills is problem solving. And, a lot of people have observed over the years, well, problem solving doesn't work that good when the person is totally out of control, I mean, it's like that person really does not want to listen to anything about problem solving.
Yeah.
So you got to do that.
And problem solving at a level 4 starts looking like, well, I don't like my place, so I'm going to run out in the street, or I don't like my house manager, so I'm going to punch her in the face. Those kind of things. We're trying to fix things, but we just don't have the ability to really go through. Do I have a clear picture? Am I is this urge going to be helpful or not helpful? What is my on-track action and how am I going to, all those foundational skills are really important. I mean, the other cool thing about the skill system, I think, is that it's tailorable to people that maybe they're coming into a crisis program and you don't have time to do a full standard skill system approach. You don't have time for 12 weeks of group, or you don't have time to do the e-learning. So that's one of the things we can do is to go in and take we call it an a la carte approach, where you go in and you pinpoint like one skill or sub-skill to work on, at a time to try to help the person. Maybe they get up to a level 4 and we focus on, in a short-term program might be, all right, well, how can you get to a 4 and then not go to a 5, which is hurting self, other, or property? And what are the tools in that space? So maybe one of the skills is called safety plan. So maybe we do some safety planning and we practice, and maybe somebody with less verbal ability, we, kind of get some images of their bedroom or their sensory room outside or whatever. And we practice them, kind of helping them go to these places. Maybe when you start, it's after the event, you practice, or when they're calm. And then eventually try to do it sort of on the front end of the escalation, sort of before they're up at that high level. So we kind of get it, further back in the chain over time. Shaping's really important. And another sort of, that a la carte's important around just building new activities for people, so that they can come in and learn activities that'll help them focus and ones that'll help them feel good and self-soothe and distract themselves and have fun. So those are some little tactics that if you don't have the full time to work on, you can still be doing skill system work.
Right. Now, I want to remind everybody that's out there, if they have a question, there are 2 ways you can ask a question. One is you can take yourself off mute and just break in. The other is if you want to type a question into the chat box, we will ensure that Julie gets an opportunity to answer that question. So Julie, now being a good time if you want to kind of shift over.
All right. Now I have to do the IT thing of sharing my screen. Okay, share content. Is that? All right. Well, for those of us that are not on, a visual, I'll try to sort of talk our way through this. So one of the things I thought might be helpful is to just kind of go through some of the resources that might help you, whether you're, just sort of never heard of the skill system before and just jumped on, or whether maybe you're sort of in that pre-contemplation. I try to build it so that there are resources for every sort of place in the learning process. So if you go to the Skills System website, which is just skillsystem.com, There's a lot of information there about the model, and there's a lot of information there that can help you sort of get to know the model better. So I thought that I might just start out sort of on the home page. So if you're on your phone, you might even be able to go online right now if you want to do that. You could just go to skillsystem.com and you might be able to see what the heck I'm talking about if you don't. So the first thing that I just figured we can just look through the home page really quickly. You can see listen to the new Skills Wrap regulators is a little fun activity. So if you want to, as we look through this, you could turn on your rap song and do this little tour. But I won't do that because it's going to be really loud and you won't hear me talk. But it is pretty fun. I would recommend listening to it. And then you just go down. There's usually training announcements. There's a training in March, a 2-day training. That'll be fun. Sign up. It'll be a good time.
Where is that going to be?
It's up in Needham, Massachusetts.
Oh, okay.
It's a really nice training site. There's a hotel right nearby if you need to escape. After the holidays, come up. We have a really great time. All the proceeds are going to an organization called Raw Haiti, which helps kids in Haiti.
Okay.
So anyway, here's a video about the skill system. So if you want to know a little bit more about it, there's a 3-minute video. If you want to expose your team to what the heck the skill system is, at a team meeting, you can put this little video on. It'll talk you through it'll explain what the skill system is. If you go down a little bit further, there are these little call-outs here. Who can the skill system help? So basically, it's a model that's used with all sorts of folks with and without disabilities of all ages, different psychiatric issues, folks on the spectrum, just a wide range of ages and issues. Down here, there's a sample also on the website of the handouts. Now, there is one that for some reason my computer doesn't like it. So if you go to that, there is an assortment. This is a trick. If you want to give, because sometimes you have to give a presentation about, like, Bruce, you were kind of giving a little presentation about what is the skill system. This sample set of handouts is really handy for that. So if you have to say, explain the skill system to your team, I would recommend going to the view sample handouts and just talking them through it. It's a nice collection of really basic handouts that I can't show you right now. But if you just go through those, probably it would take you an hour or so. You could just explain each of the handouts, and it's not the full 150 pages. I've organized them for this, like one major one for every skill.
Let me clarify something. The e-learning is for therapists, right?
All right, let's go look at it.
Okay.
Let's go to a little visit on the e-learning. So the e-learning, let me just go to that page really quick. So the e-learning here, you can go and watch a video about the e-learning. If you go to the e-learning page, all the different membership levels are here. There's an example of agencies. So if you open this here, there's like examples like, oh, I'm having some problems here. Okay. I think it'll open for other people and not me. And so these are the different memberships. It's basically $20 a person per year for agency staff, and there'll be course 2s coming out in February. So there'll be about 6 hours of training on there for $20. And there's competency evaluations. You get a letter of completion. You earn little badges, and we'll go take a look at it in a second. I think one of the cooler things is the clinician membership. This is for outpatient therapists. And so you can get either a 5-slot or a 25-slot. And the 5-slot is $75 a year. And so you can put people on and take them off of it. So say you're an outpatient therapist and you're seeing a teenager or something. So you can put the teenager on, they can earn their badges and do it. And then you can put the mom on, or the dad, or the grandma, or the teacher. And so you can for outpatient clinicians, this is just trying to do the outreach, which is so hard to do. You know, we just don't have time and we're not paid to train everybody, you know. And so by getting them on the e-learning, you are able to kind of put people on. And then once they leave services, you can take them off and use it for somebody else. I mean, honestly, most times clinicians get the 25 slot because sometimes one person can gobble up, 4 or 5 slots. Like if, say you're seeing an adult who lives in a group home, you might want to put the client on there, or they'll use yours if they can't function, if they can't use it themselves. But maybe you put their group home manager on, or their staff, or their family member, or their, somebody from their church, or whoever is there. Like, when we do our person-centered planning, like those people that are important to them, those are the ones, that we would want trained. Like, for example, like say in a crisis program or a transitional program. I mean, part of our problem is that the teams aren't ready to take them back yet, because it's almost like seeing like a respite or something. So when people are admitted to those programs, I would recommend they get put immediately on the e-learning, saying, look, you're going to get ready to take this person back. This is the stuff they're learning here. You want to be able to be a skills coach when they get back. So here, get started, and you can monitor their progress, which is good. So if they haven't logged in or you're dilly-dallying, you can sort of email them and say, how's it going? I see you're having some trouble getting started. Do you need some help? So it's a way to kind of shepherd people and mentor them. I mean, there's still work to it because, although we don't have to do any more training because I do it for you in the e-learning, you do have to kind of do this cat herding towards, getting them to do it, get on and to use it. So.
Well, and so this is a tool for therapists essentially, because as a therapist, I'm often assigning homework. A lot of times that homework doesn't get done, but this kind of provides a little bit more of a user-friendly way of being able to do that.
I think so. I think that's a great way to think about it. And I think the other thing is all the written resources that we get, and in course 2 there'll be even more. So I don't know if you can see my screen now. We're going to go into this account, and you can see. So this is just, I don't know if you can see it, but if you sign up and get the $20 whatever to learn the skill system, it's basically a day and a half of training that you're not having to do.
For $20, that's pretty good.
Yeah, for $20, it's pretty good, and you can do it on your phone. You can do it anywhere. It's good. I mean, it doesn't have the same, interactivity that doing a regular, and we can't troubleshoot and do those things that are important about on-site training, but you get the nuts and bolts, and it's really, really good that way. So in February, there'll be a second course here on the course page. This is the Skills Basics, which is course 1. Course 2 will be Skills Coaching, which is, okay, now we've got the skills of how are we going to help people, get a clear picture and help them make on-track choices and those kind of things in a way. So that'll be here in February. It's in production right now. So let's go in. So the e-learning, you just click, you sign up and I send you a link. Sometimes it goes in your spam and you have to look in your spam folder, but I usually, so once you get that, and if you don't get it, then you have to just email me and I'll send it to you. Or you can always do forgot my password. That usually works well too. So you go in and I don't know if you can see, move you guys, move us. So you come in so you can see the badges for all the lessons you can learn, earn, and then you also, all the videos are here on the side and you can download, so you basically watch the videos and then underneath each video there are practice exercises. But when you go into your course, usually there's resources like your skills plan map, for example, is a 1-page sort of summary of what the skills are all about. It's like skill system at a glance. And so you can download that. It's not a great sort of client tool because it's kind of dense, but it's a really nice visual sort of for staff. And it can also help you when you're learning and targeting. Like, remember how we said that a la carte idea of like, how am I going to teach, say, this person that maybe has less verbal ability? It helps me understand, like, I can look at safety plan and look at, well, I'm going to focus on just helping the person, say, move away first is what we're going to work on. And so you can see that if you go down to safety plan, there's a move, part of that is move away. And so it just kind of can help you see the big picture of the skill system.
Hey,
Yep, go ahead.
We had a question in the chat box. They're just wanting to know what groups or demographics of presentations do you observe the skill system to be effective for, or most effective for?
Well, that's a great question. So age groups you're saying, or demographic?
Well, he has about severe mental illness.
Yeah, definitely. Yeah, I mean, I think that folks with verbal, so one of the questions I get is, what level of verbal ability do folks need to have to do this, So I think that as someone's capacities, verbal capacities or intellectual capacities go down, I think the model is still helpful, but it requires the team to have a higher level of competency, because we end up having to be the scaffolding. We have to do the chewing and digesting, kind of like I used the idea of sort of the mama bird. You started with the gross stuff. Well, I'll continue with that. So we're kind of like the mama bird who takes the food, chews it up. We chew up the skill system, and we kind of share it with our clients in a way that already kind of has it digested. And so we have to really understand the concepts well to be able to get into those kind of, fine granular points that they can actually learn given whatever their cognitive status is or academic status is. So I think that depending on our level of investment, there's a wide range. I think even clients with dementia or some TBI or lower cognitive capacity, the concepts can still be helpful, because what happens is it helps us know what to do and what not to do. So we'll help them engage in some NUMMI activities that help them self-soothe or help them focus. We're not going to engage in things like problem solving and those other highly verbal skills when they're escalated or when they're uncomfortable. And so it helps us kind of know the do's and don'ts of what's going to help them sort of return to baseline, and what's going to help what's going to help sort of them return to baseline, and what's also going to escalate them. And so those are, and I think also, say somebody that's, sort of psychotic or has some psychotic episodes at times, we have to be really good at sort of helping them when they're in a clear space, giving them tools, teaching when people are calm and regulated, helping them have the tools that they'll need when they're not as clear. And then also just making sure we use lots of visual aids. For example, this is like a little game, an example on the board of like the card game. So this is a visual learning tool, that you get to download. But let me just show one other thing that, the new posters, so in course 2, there'll be some really cool posters available. And this goes to the person's question too a little bit, just about scaffolding, that we have to be good teachers and kind of know when to use standard approaches, when to use a la carte, how to teach, like adolescents, same thing. We can't just talk at adolescents. We got to be fun. We can't go in the front door. We've got to go in the window. You can't go in the window. You go down the chimney. We've got to be flexible with it. And so I think that it is a model that's used with SMI folks. It's used with people with autism. But clearly the teaching of the concepts has to be adjusted. We go to maybe interest areas. We make sure, like with folks with autism, I have a work group going right now to sort of help us flesh out how the teaching, needs to be adjusted for that population. And so, yeah, I think it's usable and it requires some adjusting. That was a good question, though. I hope I answered it.
Hey, Julie, I was going to mention, you were talking about, the rating, the rating system,
Mm-hmm.
0 to 5 rating system that you have. I had a fellow with autism spectrum disorder who is really concrete about a lot of things, but he is fascinated with instruments, like airplanes and the instruments, that the instrument panel in airplanes, and actually had gotten him involved in driving a tractor. And the tractor, one of the great things about his tractor was, actually it's part of the article that I wrote today, but the tractor for a while was overheating quite a bit.
Oh, there you go.
And we were able to kind of translate for him this, the rating scale, 0 to 3, you're here. But when you get up into this red zone where the for the tractor starting to overheat, you're getting into a 4 or 5 territory. And then it made it a lot more clear to him what we were talking about. And that was just an idiosyncratic thing that for him worked.
Oh,
but a lot of times you are looking for those types of
Oh, definitely, definitely. And that just shows the level of sort of creativity, that really helps make it, helps somebody understand it, makes it more personal. Yeah, I think, those different NASA ones that are rocket ships and shuttles, and you can use, I love driving is good, getting a clear picture is like you getting in your own driver's seat. And, there are times when we want to go forward. There's times when we want to sort of be neutral or go back, and when do we put the gas? When are times when you're sitting in the trunk instead of the driver's seat? How do you want to drive? Do you want to run head on to other people? Do you want to be in the ditch? Where's your goal? Do you want to stay on the road to your goal? You can see that kind of analogy can work a lot, especially that's a good one for adolescents too, because a lot of them either are new drivers or want to drive, and
right.
So you can kind of use that idea, to kind of be a fun teacher. I think that's part of it. And skill systems got to be fun. When you start, if you say you do want to learn more of it, a lot of times people start out by getting the book. It's got a very detailed curriculum in it, a 12-week curriculum that's really like a worked example of how to run a group. No group ever goes like that, which is part of the model. It just gives you a guide. And sometimes, what I find with teams like this, I was just on the phone, Zoom this morning with a team from the Netherlands and Iceland, and they're running it, a group pretty much by the book, but the first time through, it's more like parenting, the first kid, you're doing everything right and all the right stuff, and second kid comes along and you're a lot more relaxed and you can have more fun. And that's kind of like it is the first round through the skill system group. You kind of, getting your chops together. And then after that, you get the fluidity that's needed. There's a growth and a creativity that's really key. You've got to be able to just dive into conversations with people and not just be static. And
so did I get this straight? Your model has now been transported to Amsterdam?
Oh, yeah. It's pretty cool. That is
cool.
A full translation into Dutch. Let me just show you. It is kind of cute. I mean, of course, I can't read a lick of it, right? But so here it is in Dutch. Oh, that looks really simple.
Okay, yeah.
That's so cool. It's really long. For those who can't see, it's really long words that are impossible to pronounce. So Dutch and Iceland it's in Icelandic. Also, it's in Swedish. I work with teams in those places. It's translated into Korean. South Korean, unfortunately not North Korean. But also Australia uses it. It's not translated for them. But yeah, it's really cool.
Really
to work with teams all over the place. And they deal with a lot of the same problems that we all deal with.
Oh, yeah.
It's staff training is, again, a really huge issue. And that's often what everything comes back to. They run groups and it's really fun. And the problem is that, it's hard to train the staff. And then folks leave and they've got all these stressors in their lives, and when they go home and they don't have people to support, because we keep hearing all this, generalization is hard with this population. Okay, well, part of that's because the environment isn't prepared, to do it. So I'm hoping that that's what we're trying to work on. Just on that note, so just before I try and get rid of it here, but this is an example of one of the posters that are going to be like a free download in course 2. So there'll be visuals for each skill so that they're kind of fun and colorful and they go along with the material in the video. And so the staff and the clients can have copies of these things, like maybe little cards or bigger cards or regular sheets that are laminated or posters or whatever, but all that'll be downloadable, so that they can so they can give a client, maybe they're working on clear picture. This one here is for clear picture. And, so they can stand shoulder to shoulder and kind of go through and get a clear picture together, so when they're doing their coaching. So I don't know. I just think I'm trying to think of the tools that will help, because the staff has so much on their plate with all the different trainings, all the different models. It's really challenging, to get everything done that they need to get done with the amount of training that they have, the amount of time they have, with the acuity of the clients that they're dealing with. So just trying to think about ways that'll make it easier. So the e-learning, I think, is,
and you know, I know a lot of people have struggled with, how do I do this with someone who has a severe communication problem, or difficulty communicating with words, let's put it that way. But at the same time, if you're not able to get these sort of micro skills that we're talking about, like noticing urges or noticing, you know, rising emotion with yourself, noticing your breath, other things like this, you're really still going to be struggling with how do you help the person with this. And so, you know, you just have to figure out a way, I think, to translate it and make it real for the person.
Well, and targeting is really important. You know, the more we know about the model, the easier it is to target. And so, I mean, targeting starts in sort of this is what Course 3 is going to be about, actually. It'll be about individual therapy strategies. And so, you know, so basically in pre-treatment, what we would do, and this isn't in the book because the book was built to be the skill system was built to be part of DBT. Well, DBT has something called pre-treatment in it, where a lot of commitments made, where you clarify your goals, you clarify your targets, you make a commitment, you know, you have a therapy agreement together. So this whole big pre-treatment phase, you know, isn't even in the book. And so it assumes that you're doing some kind of pre-treatment phase with your clients before you jump into skills. And so, you know,
I've got another question here for you. So the kind of percent of this discussion that we're having, Wendy Sullivan's asking, if there is any data available on success with different levels of ability?
Yeah, that's great. Well, you know, we've got some good pilot data, and I've really been focused. You know, I'm glad I'm 56. This is one of those secrets, right? That we're going to say that personal information.
Okay, yeah.
Yeah, okay. So I'm 56 and I'm a vegan. I'm trying to live a long time, right? Even though I have some issues. But I'm going to need the time to get this all together so we can get some good data. Because one of the problems is that I really have known in my gut, which is we haven't built the full model yet because we really need the environmental supports to be there for us to really be able to get good RCT data that is going to show within an X amount of time that we have, you know, real changes in emotion regulation capacity. I think we have to address them. And so, for example, we got a NIDLR grant this year for an app that will be used. It's designed for people with intellectual disabilities, as well as it'll be able to be a tool eventually for staff too. So between like running groups and the e-learning and things like the app, I really think that those are the types of tools that are going to be necessary to have in place, just knowing the systems that I do, that they're so complex, that those tools are going to be necessary prerequisites, I think, for a study. So long answer is no. No, I don't have, it's anecdotally, I have people translating the book out of faith saying, we have to do this, we have to do something.
Let me also mention this, Julie, that I think one of the things that we really need to be kind of addressing, because so much in our data collection is related to the frequency of different events, but episodic severity, I think, is something that needs to be sort of a measure that we use to evaluate the effectiveness of different strategies that we're using, particularly the emotion regulation strategies. I think that's important. Using that 0 to 5 scale to evaluate how far did this go, and at what point was I able to get it under control. Those are the types of things I think we need to be.
Yeah, no, I agree, and it's hard. It's a real big commitment to be able to get data collection is a huge deal with this population, to the point where we're developing something called the ERCS, the Emotion Regulation Knowledge Scale. I'm working on another project with a team, with a PhD student actually on this. And so one of the problems is, so if we go in and we look at behavioral data, which is what I love to look at, right? Reductions in ER visits, increased days of work, reduced assaultiveness, reduced self-injury, things like that, where the nuts and bolts, instead of those care or self-reports, I'm not keen on those at all. But, so the IRCS is, so that we do a pre-treatment because it's the emotion regulation knowledge scale. So instead of it being like the DERS, which the difficulty in emotion regulation scale, which says like, it asks the person to report like, how do you think you're doing in your emotion regulation, which is not as useful, I don't think. So the IRCS, that's going to do is ask people how they regulate their emotions. And so it'll have sort of adaptive strategies and sort of maladaptive strategies that are based on avoidance and repression. And so they'll answer questions, they'll go in on these different, subscales, and you'll be able, I'm hoping what we can see is a change. Like they'll come in, I'm thinking, my hypothesis is that if they're severely dysregulated, there's a possibility that they have some maladaptive knowledge base about how to regulate their emotions. And that with some training, there's a possibility that they'll be able to sort of improve their knowledge of emotion regulation strategies. So I'm thinking that that's just one way to attack the data collection problem that we have, because so many of these studies have to be so long, and it's really hard for our agencies. I mean, at this point, for projects like this, realistically, to get the RCT size that we would need for the length of time, because our pilot data shows that it took 3 or 4 years for the large, huge, for the big behaviors to come down to a statistically significant level.
Yeah, I think there are so many things to work on. That's the thing, and it does end up being a long treatment plan.
It does. We're reconstructing emotion regulation capacities. I mean, honestly, it starts in utero.
Yeah.
And we're kind of needing to rebuild, and our folks, have really had so much trauma and so many difficulties. It's, and they haven't had, the tool that actually fits what they need. So I think, I'm hoping that
we keep trying to make things happen quick, and unfortunately, I think we keep losing what we really need to be working on, in the shuffle of trying to get it done quick.
Yeah.
And so, the downside of that is, this person might not get that much better for a little while, but it's still, I think you're on a better path here than you are when you're just trying to eliminate behavior in the short term. We've got about 7 minutes left, Julie, and I want to make sure we give people a little bit of time to ask any questions they may have if they want to come on and ask. So does anybody want to come on and ask a question? Unmute yourself and ask a question of Dr. Brown. Anybody out there? We have a lot of shy people.
No.
There's shy. That's okay. I'm not criticizing. I probably would have a difficulty coming on myself if I weren't kind of already initiated here. So any other comments that you want to?
Well, I guess, I want to say one thing just while we were kind of, while we were looking at something, just if you're interested in, I'm going to go back to share my screen again. Let me just get where I want to go first. I'm just thinking like, where do you get started? And it's like, it's kind of a big model. I mean, it's based on DBT. DBT is a massive model. And I am a really big fan of anyone getting DBT trained and using the skill system. I have a book chapter that's right on the website that I published with Oxford Press this past year about doing DBT with this population using the skill system. And so that's a free download. Or you can just email me at jbrown@skillsystem.com to get that book chapter. But if you're interested in DBT and you want to treat sort of those really high-end folks that have, lots of self-injury or aggressive behavior or other high levels of dysregulation, I would really recommend you adding to your toolbox DBT individual therapy. Some of the online training that Linehan Institute is providing is only about $3,000. I mean, it's a lot more than $20, but, the things that you learn in that And I'm not sure if that's just a foundational training, but that's great stuff where you can really learn how to sort of stay connected to people that are like whirlwinds and get them and sort of be able to do a relationship with them that will help them access sort of their own self-regulation and scaffold them and help them learn skills. So I would recommend that to anybody, to really handle. I mean, the skills are good. Skills in DBT are better, to handle the really big situations. I just before we finish, I wanted to show the consultation. The consultation format for the skill system is, I think it's important. It's like, it really works with, case conceptualization, Bruce. I'm sure you work from something similar. So it's just the skill system implementation guide. If you go to the skill system website under the consultation tab, there's a brief video there explaining things. Just when you work with me, I force you to do a lot of planning. You plan, and then we figure out how we're going to do instruction for the clients and instruction for the staff, and then how we're going to build everybody's competency. So that's like part of the consultation. But I think there's a free download of something called the Skill System Implementation Guide, which I think if you want to learn about the skill system sort of in what it looks like, oh, Julie says there's something wrong with my art. I'm going to share this way. Sorry, you guys, that was a level 4. That was, all right, so wait a minute. I have it here. I have it but I have to talk to Chris about. So the implementation guide, this is really tiny, so, all right. So the basic idea is look, in your program, you got to make sure we're treating medical problems. And we were talking about constipation earlier, so number one, triage. And so DBT works with a triage system, and so this is another triage system for our clients. Number one is medical. Number two is mental illness, making sure we're treating all mental health issues. And the third one is in creating a positive environment, the environmental factors, and this breaks down a lot of factors that really do create more dysregulation instead of co-regulation. And then finally, level 4 is skills. And then this all breaks down how teams can become, kind of a skill system team and use the model, creating a leadership team and how to do it. So it's really all right there on the website if you're interested in reading these pages. So I would recommend if you're using the skill system, I would take the time to read the skill system and implementation guide. It's a lot of good information for free and
I think it's one of the things people miss a lot of times is the need to have this peer group that you work with regularly and to get consultation. You may think you know everything about the system, but yet you're going to run into circumstances where you need creativity, and that is aided by being involved in these types of processes that you're talking about. And it's a critical part of dialectical behavior therapy, in Linehan's model, and I think it's very important that you have included that here too. So this has been fantastic. I really appreciate you coming on such short notice to help us out. And I think I hope it has had an impact on some of the people who have attended today, because it is certainly a great model, I think, to start really thinking about how do we approach this, and how do we approach it with a vision, that's out a little ways with this person. That it's not something that's going to work overnight.
And there's a webinar on January 29th. We'll be doing just kind of a brown bag lunch thing where some different folks will be online, and you'll be able to submit questions and things like that. Just kind of listening to other people and listening to, me, droll on, I suppose, but about things, about the skill system. So if you're interested in hearing more about it, there's also that 2-day training. And for $20, you can get fully trained. So not fully trained, but you can get partially trained.
Yeah, at least get your feet wet pretty good here.
And give it to all your family members for Christmas, all your dysregulated family members.
There you go. Actually, that might be a very good idea. So this has been the Clinical Consultation Network, and we've had Julie Brown on here today, and that has been great. So we do this every Tuesday at 1:30 Central Time. We will not be doing it for the next 2 weeks, though. We're going to take a little bit of time off for the holidays, and we're going to return in the new decade, 2020, on January 7th, Michelle. Is that right?
I'll tell you. Okay.
Is that correct, Michelle?
I think
Yes, I said yes.
Yes.
Okay. Okay. All right. So January 7th, and we will be at 12:30 Central Time starting in January. So I said we'd do it at 1:30, but we're actually going to be doing it at 12:30 in the year. So 12:30 Central Time, that'd be 1:30 Eastern. And please join us for the Clinical Consultation Network every week. And thanks again, Julie.
No problem. Shoot me an email if you have any questions. Bye, guys.
Bye, Bruce.
Happy holidays.
Happy holidays to you.